Hi all and welcome back to my channel of an everyday life of an Aspie. If you're new to my channel, I'm Aspie. I'm all about creating mental health and awareness and sharing my life story with Asperger's syndrome and the like, along with tips and advice along the way with general health versus your mental health. Also, in saying there's some fun and games. So if you're into any of these, feel free to subscribe on the bottom right hand corner, and once you do so, turn on the notification bell for future videos like these. So today is going to be based on a topic that I'll be sharing that many people may not have heard about or what have you. So I'm hoping in saying this that we can learn from each other as well as I'm educating you on about this. And this is all about scoliosis. I thought to share this because obviously after talking to someone basically who has this condition, I thought maybe to bring more awareness on it so that we can be up and familiar about all this. So let's begin. This question people may be asking, what is it? You know, scoliosis is a medical condition of which a person's spine has a curve that it's curved sideways on their spine, or either to the left of the right side of the spine. As the result of the curvature is usually shaped like a C or an S, depending. And scoliosis derives from the Greek term crooked, so obviously it's known as crooked spine. So therefore we're going to have an illustration that will clearly illustrate this, hopefully from the very first diagram that you'll see right now, that this is based on an abnormal spine versus a normal spine. You would notice that with the normal spine, usually it's straight up and down. Here, say, when you look at someone that has, you know, been looking for at the behind. But then on the other hand, however, on the opposite scale, someone with scoliosis, however, the curve as mentioned can be bent to the left or the right. So the severity of the curve can vary from person to person, however, ranging from mild to severe, or mild and barely noticeable to severe, shall we say. In some cases there will be a double curve which will be shaped, like I said, in the C or S shape. Most cases people develop as a child, obviously, at the age of between 9 to 14 years of age, so on the onset of puberty. So the difference between scoliosis and kyphosis, which again an image will be shown about kyphosis sort of thing, so you can get a clear understanding just briefly. If you're looking at the side of someone, normally there is at least 3 slight front to back curves in the spine, one in the neck, chest, and lower back regions. And a more pronounced front to back curve, however, is called, as I'm saying, kyphosis. The difference between this is that it's not noticeable on the side, it'll be noticeable elsewhere on the back. Kyphosis quickly can occur at any age, although it's really rare at birth. Adolescent kyphosis is also known as Sherman's disease and is caused by the wedging together in a row of several vertebrae all together in the spinal columns of the back. Cause of it is unknown, however, unfortunately. Adult form of kyphosis can be caused by various other conditions, be it arthritis, osteoporosis, and spinal. There are several types of scoliosis here, and each one is cases are different of the cause. So you got number one, the non-structural scoliosis, which is your functional or postural. This one is like the spine looks normal because of another condition, which is having a leg longer than the other, or muscle spasms in the back of your back muscles. Curve is usually mild and it changes or just goes away. However, if the curve is fixed and is basically doesn't go away when the pain, you know, or shall we say when the person changes their position of their sitting. Idiopathic, which again the causes are known. More than 8 out of every 10 people will have this one. Cause is obviously idiopathic. Neuromuscular, obviously the curve is usually caused by a condition that affects the nerves and muscles of the back. For example, it may happen with someone with muscular dystrophy, polio, or even cerebral palsy, or even neurofibromatosis. Each of the conditions or symptoms, shall we say, has different, you know, every different meaning of symptoms and problems in addition to scoliosis. So you've got osteopathic as a result of a bone abnormality, which is you've got your congenital, which spine wasn't formed while you were being inside the womb of your mum. You've got the mild scoliosis, which basically affects the same number in boys and girls, but however Moderate or severe cases will be more likely to be gradually painless. 2, usually noticeable when bending down. 3, mild to moderate can develop without being noticed by a child or adult. Again, reason it develops during your spurt of teens, when you're in the puberty of your teens. Mild pain and imbalance of the muscles. It becomes more severe, however, it becomes disfiguring because of the spine curve sideways. As curve becomes more severe, the vertebrae also twist around. This then pulls away any of the attached muscles, ligaments and ribs that is surrounding them to, cause that support structure for your spine and your skeleton. Ribs and shoulder blades will stick out like a bulge on one side of the back. Also, one shoulder may hang down, lower than the other one. Or even another one, it would be a shoulder blade maybe higher than the other. In the lower back region, however, for the consequences, it makes the pelvis thrust forward on one side, and then therefore making one leg shorter than the other. MRIs, CT scans, basically X-rays, accessing the angle of the spine, CT scans obviously for the sake of your neck, basically, and sometimes the treatments as well. They'll do some testing on how straight your curvature is and stuff with specialists that prevent the curve of the spine from getting any worse. Number 2, for the aims of this, for the treatment, avoiding surgery later in life. Number 3, preventing breathing problems. Number 4, improving how the spine will look. People with more severe scoliosis may need treatment, but that will vary and it will depend on the various factors. It will be the age of the person, the sex of the person, be it male or female, if they're still growing, the severity of the curve, exact location of the scoliosis, chance that scoliosis will go through an observation through a clinical technician and whatnot. They may say also for the ones that you can do sports, but may bear in mind not to be in a rough contact sport or gymnastics. Specific physiotherapy exercises called physiotherapeutic scoliosis specific exercise, which is recommended to do twice a day, and obviously requires a lot of motivation from people that has this. Wearing a brace, there are modern everyday braces that are more comfortable than those other everyday braces that you see, which I'll hopefully talk more about the braces and another piece later today. If it's severe enough, surgery may be advised as well to wear a brace, or even for the sake of it, for the aim of the operation is to obviously correct the curve, stabilize the spine and fuse the curve, which fusion is obviously a procedure that is placing 2 or more bones together, or implants and rods that they use to keep the spine straight. The rods then are typically growing or lengthened every 4 to 6 months. Can't be guaranteed to make any different, but however, people with scoliosis may find these complementary techniques useful to improve their backache and pain. Maybe acupuncture, homeopathy, chiropractic kind of stuff, reflexology, neurostimulation and the like. So this quickly ends a real short video of all about scoliosis. Smash the like if you enjoyed this. Comment below. Feel free to share these videos around. Feel free to also subscribe to my channel if you haven't done so. If you want to join me on the bandwagon, feel free to also turn on the notification for future videos. Don't forget to also follow me on my social medias, because like I said, I try my hardest to keep you guys posted up on the daily for that as well. And all for the two guys, also hopefully in saying this, I'll show you a video later on of an interview with this person that I'm going to introduce to your channel, and if you want to see that, hold on tight for that, and I'll hopefully link it to you guys so that you can get a better understanding about what her life is like with